Renaud from Pixels and Pills. We recently attended the 2010 Digital Pharma East conference in Philadelphia. We interviewed many key opinion leaders and came across three main themes. We discovered the prevalence of digital and that companies cannot ignore the digital space. We also learned that it's all about communication, and in order to participate in the conversation, you must listen and engage your consumer. The following are what the interviewees had to say.
You're in trouble, but there's a way out, and the way out is the digital path. The very thing that is destroying you is going to rebuild you, and you'll be better and stronger than you ever were. If you understand that it's not about, dictating your message, but having relationships with your audiences.
It used to be, like I said, offline awareness and acquisition, moved to the online engagement. Now I would say it's really online understanding and awareness building, and then it's maybe to the offline at the doctor's office or a TV spot to galvanize them. But in the end, it is digital.
Quite a lot you see certain companies giving things to interns or to people who are young, who obviously must know what Facebook is because they're under 25. And of course, actually, it's not really about platforms or digital technology. It's about communication, and that, when you're doing it on behalf of a pharma company, is very complicated.
It's starting to look like e-patient communities could sort of be the next virtual community-based organization. So to see that sort of true partnership is maybe the one thing that's kind of missing so far.
One of the things that I think is fundamentally important, certainly from my perspective, very valuable, were the patient organizations who could speak to what they felt was necessary to support patients, not limited to particular products, but everything from the way of life to the diet to the therapy to the rehab.
I think we should hear more from patients. I think we should hear more from physicians. I think that'll help the pharmaceutical industry kind of know what their next strategy is as far as how to talk about their products.
The ability to hear directly from patients, to see those quotes and verbatims, really helps you to uncover barriers, uncover educational needs, and use those unique insights to drive innovation and new ideas to drive successful outcomes.
How can pharma harness these opinions, which is essentially an unsolicited, focus group out there, and make it useful for them, for their businesses?
The truth of the matter is that people aren't owned by communities. So one of the biggest things I think is for people to get rid of the idea of trying to own people, and just trying to give people decent content, decent information, the ability to speak negatively about your company if they want to, or ask questions, and for you to respond, like John says, as a human being, and not respond through the legal department or through a load of kind of broadcast messages.
Listen to what people are saying about you, listen to what people are saying about their health. Listen to how people communicate about pharma in general, about your pharmaceuticals in particular. Listen really carefully, and then figure out a way to get in on the conversation.
I've always advised pharmaceutical companies to get their people involved so that if they're responding in a Facebook page to some comments, and it's not just the brand responding, because people don't talk to brands, they talk to other people.
I don't think the code has been cracked, but the discussion is getting further along to where the code is about to be cracked, okay? I mean, people are going to start to engage.
We've seen this evolution. I think 2 years back when we came, it was all about, do I listen? Do I really get into anything? What do I do? Let me test the waters. Last year it was more around, I'm doing stuff. I'm still trying to figure out, is this the right stuff? I have to be wary about what, guidelines are coming out. This year I'm beginning to see a much wider audience, willing to listen, willing to understand, and willing to see how else I should, use all this and make it useful for me. And that's really what our talk was all about.